We've come so far in beating back the coronavirus, and we've got more to do. And what we've learned in this crisis is nothing is more important than your health. We all kind of knew it before, but now we know it more than ever. If New York City is healthy, all things are possible. If our people are healthy, we can come back strong. We know, and this crisis has made it very, very clear, that there are profound disparities in terms of who gets a lot of health care, who gets a little bit of health care. There's even people who get almost no health care. That doesn't conform with the values of the city. We believe everyone deserves health care in New York City. We believe health care is a human right. And our task force, leaders of city government agencies, leaders of color in key agencies all over the city government, when they looked at the disparities that have been made clear by the coronavirus crisis, and the mandate was, what can we do right now to start addressing those disparities? They came back with a clear mandate for this administration. They said, let's move up, let's speed up our efforts at providing guaranteed health care for all New Yorkers. Now, we announced this a couple of years ago. We said that every single New Yorker, if they didn't have health insurance, we'd help them get our city public option health insurance if that was what worked for them. And if that didn't work for them, we give them an NYC Care card. We give them the ability to have a primary care doctor in a medical home and pay only that which they could pay, regardless of documentation status, regardless of income. That's what NYC Care is all about. This is something that has never been done in this country, but it's happening right now. In fact, it's been sped up. So today we announced that the rollout of NYC Care to Manhattan and Queens, these were two boroughs that it was supposed to take several more months to reach, but the extraordinary team at NYC Care made it happen much quicker. As of today, we are ready to move forward with NYC Care throughout Manhattan and Queens. All 5 boroughs will now have NYC Care 4 months ahead of schedule. So it's extraordinary, and it's not only something to be proud of as a New Yorker, it's not only something that's available to you if you're one of those 600,000 people who hasn't had health insurance coverage in this city. It's also a cornerstone of our comeback as a city. Every New Yorker that has health care will be in a better position to stay healthy throughout this crisis and help us beat back the coronavirus. Health care for all is one of the ways you stop this pandemic and any pandemic. So for everyone, if you're out there and you don't have health insurance and you can't get health insurance, call 646 NYC Care. Again, 646 NYC Care, and you can sign up in all 5 boroughs as of today. Now, this is an amazing effort. I want to thank everyone at Health and Hospitals who made this possible, but particularly the team at NYC Care. And I want you to hear from the leader of that team. She has done this work with extraordinary passion, and she's been doing it for years on the national level, brought her talents back to New York City, from which she comes, to make this the first city to guarantee health care for all. The executive director of NYC Care, Marielle Kress. Can you hear us?
Thank you so much, Mr. Mayor. Yes. Hello. Hi, everyone. Thank you so much for the opportunity to speak. And thank you, Mr. Mayor, for your leadership on this issue. I am so proud to lead the team at Health and Hospitals of people who are implementing the largest program in the nation of its kind to guarantee healthcare access to all New Yorkers, regardless of where they were born, their immigration status, their ability to pay, their insurance status. I can't overstate the impact of the peace of mind that I've heard from people that I talk to that comes from knowing where to get care, knowing that you have someone to help you navigate the system, knowing that there's a primary care provider that's there who cares about you and all aspects of your life and health. And the human impact that I've seen is so great. I want to tell one quick story about a member that we have who became a member in November 2019 after coming to this country a number of months before, and was a kidney transplant recipient in his country, and came to this country, was receiving medications from his home country, and didn't realize that he had access to guaranteed care here in New York, in the Bronx, where we started. He got connected with a primary care provider, and then, very unfortunately, contracted COVID-19. And when he got sick, he called his primary care provider, and she encouraged him to go to the hospital, where he was intubated at Bellevue Hospital for 21 days. And so this story really shows that having this access, knowing who to call when you're sick, knowing where to go, is the difference between life and death. And I am so incredibly proud to lead the team of folks who are implementing this at health and hospitals. I've seen the national effort to make access to healthcare easier for folks. And I just wish that all across the country in the future we can have this model, because unfortunately we've left out so many folks, so many hardworking, tax-paying Americans who do not have access to healthcare because of their documentation status. So thank you, Mr. Mayor, for your leadership on this issue. I am so proud to say that it's available in all 5 boroughs, and please call 646 NYC Care today, 646-692-2273 to get access today. Thank you so much.
Excellent. Thank you so much, Marielle, to you and your team, something you should be very proud of. Again, first city in America now on all 5 boroughs to guarantee health care for all, and this is needed more than ever with what we're dealing with the coronavirus.